We're at part 10 of Pregnancy and Human Development. It's page 1087. And at this point, we've had the baby. And now the next step of the process here is adjustment to extrauterine life. And so there is sort of the big picture and some of the details here then. The big picture is that the baby will go through, ideally, a neonatal period of 1 month, 4 weeks or so, sort of a quarantine in a way, in which there's just the maintenance of the transition, which begins rather crucially and then smooths out across that 1 month. So the idea that one has had a very severe trauma is part of the program here. The birth process itself and squeezing through the canal and enduring the many stages of contraction and wave-like forces of the musculature to force the baby out. And then once the baby is out, the baby is suddenly at a loss for what has here Merib is saying cast out, as it were, of its watery, warm environment and its placental life support, which provides both nourishment and cleaning up of waste products. So there's all of that to be considered. Eventually, the umbilical cord is severed, and the baby is on his or her own. Then now it must do for itself. It needs to respire on his or her own, obtain nutrients, excrete, and also maintain body temperature. All of these things. Okay, obviously with a great deal of help from the parents. So right initially at 1 to 5 minutes after birth, how shall I say, it should be the moment of bonding with mom and learning where is the nipple and how to latch and suckle. But nevertheless, the hospital often, if that's the hospital birth, and not a home birth, there is the APGAR score of basically a number of things that total up to 10, a score of 10, and you're trying to get the 80% or better overall score for the baby, the color of the skin, the ability to breathe well, the apparent comfort or discomfort of the baby, the temperature of the baby. There's so many different things to consider, and so we're looking at that particular score. So taking the first breath and the transition here is what's of essential consideration. And because of the loss of placental support, and also because the bloodstream is now changing in maximal ways, the umbilical vein going to the liver and then sending blood onto the heart is now going to contract and become vestigial as the ligamentum teres, the opening between the atria of the heart, is going to close and become the fossa ovalis, and the formation of the ligamentum arteriosum that used to be the ductus arteriosum going from the pulmonary artery on usually the left side going to the aortic arch is going to go away. So now we have to get to the place where the baby is actually oxygenating its own blood and doing all of the required things. So that transition period to what would be 45 full respirations per minute at the beginning of life, and then only slowly declining from there across the next weeks, is what's hoped for. Then we have this 6 to 8 hours after birth for all of those things that I've just described. right? So the changing of all of the vasculature to the correct vasculature, and hopefully there's no congenital defects that would prevent that from happening. And this is referred to as the first transitional period. Okay, and then we press on from there to the idea that we have to now consider. This is the things that I've just mentioned to you. You can go over these slowly in the diagram that I gave before, describing the differences between the fetal arterial and venous system and the neonatal or postnatal arterial system, and the changes that must be gone through. This is one of the big ones right here, is the fossa ovalis, one of the more common features that does not close. Used to be the foramen ovalis and becomes the fossa ovalis. So that's a very important one. Then we have lactation on behalf of the mother. That is to say, lactation is the production of milk, and there's a little 1, 2, 3 here. We need to have rising levels of placental estrogens and progesterone and human placental lactogen. This is while the baby is still in utero and on the way to birth. So this is the preparation period. Those 3 molecules have to be present. And then we come over here to now page 1088, and we're noticing here that the hypothalamus has to create a new set point, wherein we're going to get the release of prolactin, and that's going to there's releasing factors. There's prolactin releasing factors from the hypothalamus, which then causes the release of prolactin from the anterior pituitary. Okay, and then once that happens, we have preparation for that day's feeding. Okay, and each day subsequently requires that sort of initiation, where the actions at the nipple will stimulate the hypothalamus to have more of this prolactin releasing factor. They're calling it PRF, and that gets you the next day's worth of prolactin, and day by day you press on. The importance of milk. Let's begin with colostrum. This is the very first secretion. It has less lactose than milk, almost no fat. It contains more protein, more vitamin A. Maybe that's why it has a slightly yellowish color, as the carotene aspect of it. And then minerals, more than true milk. And it's also very rich in its supply of immunoglobulin A to protect babies' intestinal organs. Okay, so that's the deal right there. The mechanism is basically that there's receptors on the nipple that send afferent nerve signals up to the hypothalamus. The hypothalamus gives us the prolactin releasing factor. We get then the prolactin for the next day's feeding. And this goes on as long as mom is feeding the baby. And this is a positive feedback mechanism, including oxytocin. Don't confuse prolactin with oxytocin. Anterior pituitary, posterior pituitary. This causes the letdown reflex. And there is myoepithelial cells in the breast that contract and cause the milk to flow. This is also one of those features that is unique to the female, not to the male. Generally speaking, its requirement is estrogen to create the oxytocin receptors. And so the crying of the baby, in fact, can even cause the contraction of these cells and cause milk letdown even when the baby is not present. Right, so there's all of that. Breast milk has advantages. It's fats and iron better absorbed. There's a better actually spectrum of amino acids specific to the baby than those of actually any other milk or protein origin. It has a host of beneficial chemicals, including immunoglobulin A, but there's a lot of other features that prevent overzealous inflammatory responses. It's possible for babies and children in general to have spiking fevers and overzealous inflammatory responses because they are very powerful homeostatic systems in a small body. Okay, so then we have the breast milk. It says here also provides bacteria for flora, so baby is actually sterile until baby gets its first flow of milk from mom with the immunoglobulin A. So the balance of what is flora and what is immune system is all coming together. So this is an important positive feedback feature you can read about. You can take a moment here to look at this display and focus in on anything that is of interest so that you understand the positive feedback. And we're concluded. We have the baby.